I want to thank Council Chair Selberg for inviting me to come, and I suppose we can decide if this will be a monthly report or not, as you wish. But really glad to be here today. It's been, I've come before you a lot in the last few months, and it's actually kind of refreshing to be bringing a bit of better news as to how we're doing as a community. So appreciate the opportunity to do so. All right. So this, in just kind of refreshing you a little bit on what we're paying attention to and really what our priorities are with our COVID response, whether we're in full-on emergency operations or we're really pared down and scaled appropriately for the level of response needed in this community. There's still these 5 principles and objectives that we're paying attention to. They haven't changed. They continue to be the same, but I thought I'd put them up for the community just to be reminded of what are we really making sure that we're paying attention to and want to prioritize for our community. So we're continually reviewing, we're reassessing and realigning appropriately. And so you've seen, a scaled approach in the last few weeks to COVID response. And we're really in that continual review phase right now and making sure that we're paying attention to where the data is taking us. So with that, a couple of things I'll share with you. You all are receiving a weekly dashboard that helps to keep you informed as policymakers. And so one of the blocks in the 4 dashboard segment that you get is that 14-day trend of COVID cases in our community. And we've been fortunately really sitting at a very low level. It's called a low incidence plateau is where we're actually at. As long as we are under 26 cases per day, that would be the per capita rate that we should be below to be in a low incidence plateau according to CDC guidelines. Then that is one of the indicators that we can measure, and we are in a low incidence plateau. This is that 14-day trend, but it still gives you that visual of where we're at as far as being in a low incidence plateau, because even with that averaging, we're sitting under 26 per day. There's one day in the last 2 weeks we got up to 26 cases, but other than that, we've been sitting really quite a bit below that. And so we're really grateful for that right now, but we'll continue to be monitoring that. The summer's really busy now. A lot of stuff going on, a lot of activities, a lot of people getting together. We just got through a holiday with a lot of family activities. And so we continue to monitor this every day, and we'll continue to get this out to you every week. So like for example, today we had 18 cases in Minnehaha County, 5 in Lincoln County, and 1 in McCook, and 0 in Turner. So our MSA in total had 24 cases. Hospitalizations have been ranging right in around that 20 to 30 range, and you see that as well when you get that weekly snapshot. And so that's something that we continue to monitor. We know that is the sort of priority. One is really keeping people healthy, right, in our community, but also in terms of from a policy perspective, making sure that we have access and accessibility to resources in the hospital for those who need it is really a very high priority as well. So very lucky, hospitalizations have been remaining really low in our community. And we can't say the same for surrounding communities in the region. As you can tell and know probably very well, there's communities within the tri-state area, for example, which are having a real stress to their hospitals, and unlike we are here. So then the next slide is really that positivity rate that we also pay attention to, and we monitor this rather than doing this as a daily monitor within the health department. We are actually monitoring this weekly. It's a little more accurate. There's more accuracy to monitoring it weekly because hospitals are required to report their positives every day, so you can quickly get on it and do that case
that interviewing, containing it, case tracing, et cetera. But they're only required to report their negatives once a week. And so because of that, we report this out on a weekly basis, so we can not be seeing one day a 13% positivity and the next day you see a 4% positivity because of how they're reporting their negatives. I hope that makes sense to you. But the positivity rate then is the number of positives against all tests that are done. And you want that to be around no more than 10 to 12%. They haven't landed on the exact if it's less than 12 or less than 10, but studies and experts are saying, you want it to be less than 10 to 12%. So we've been fortunate that, in the last weeks, we have been maintaining a really nice positivity rate. And that's one of the things that tells you you're doing enough tests in the community to pick up the positives that you need to be picking up. So you have to be doing enough total tests to really know you're grabbing positives to be able to maintain control of the spread of illness in your community. So that's one of the things that we're monitoring as well. If you ever have any questions about any of the things that we're sending out, don't ever hesitate to just shoot back an email to myself or Sandy Friends or anyone on the team. We'd be happy to ever talk about this in more detail. So it's just important to remind us, too, the age breakdown of COVID. And this is a state picture, not Sioux Falls specifically, but it was what we could easily grab for you, but not too different from what we're dealing with in our community. And so you can see the number of cases is really higher in that younger demographic. And that's really good news for like the education and the prevention and all the things that we're trying to communicate about. If you're at high risk, which is the older you get, so the more high risk you are, the more you have to really be thinking about, how much exposure are you going to be putting yourself in when it comes to, being out in the community, et cetera. So we have very low incidence in the state for, the number of cases of COVID, but conversely then, our death rate is much higher in that older population, which is why we are doing so much of that education about, for all populations, that be greater than 6 feet from each other, wear a mask if you can't, make sure you stay home if you're sick, if you're a vulnerable population group, please stay home. Those types of things, use good hygiene principles, make sure you're cleaning surfaces, et cetera, like I did just before I got up here after following Mike. And so those are the things that, we're continuing to push out there as well and make sure the community is aware of, because we don't want to see people, succumbing to this illness, to COVID-19 any more than is absolutely, if we can prevent it, that's what we want to do. So a couple things I'll just also say is that as I mentioned before, we're continuing to monitor the data, continuing to do that daily. We are continuing to, we want to make sure that we're continuing to mitigate the spread by following the CDC guidance. If you go on our website, it's siouxfalls.org/COVID-19. You can see there's a lot of guidance in there that we refer to, but cdc.org has everything you need to know about mitigating the spread and preventing yourself from getting sick. SOAR continues to be very busy, and just a couple of stats to give you about their activity. And if you remember, that's the group between the health department and building services that goes out and does technical assistance. Jeff Huckhoff has done a number of, briefings to you around that topic. And oh man, I just am so impressed with the way our two departments have been working together to serve the community that way. But we've had around 100 complaints about that have come to our office around things like people not social distancing, people not wearing mask use. So we can go out and actually do more education, whether it's a business or a organization, for example, to be able to talk to them and help re-educate them on the proper use of PPE where it's necessary, or wearing face coverings, make sure you're social distancing, et cetera. There's been over 250 referrals, questions, or verbal assessments given by phone or by email. And so that's people calling in and just having some questions and wanting to talk through some things that they're wondering about, whether it's a business owner or someone running an organization, et cetera. And then they've done 80 technical assistance assessments, which are actually going on site, doing a walkthrough, et cetera. Counselor Selberg, they did one at our Savior's Lutheran just last week, and to help with the reopening. They've been very busy with churches right now. And the school district, for example, all the school districts, they've been working really intently with them on their plans as well. But certainly restaurants, fitness centers, et cetera, there's a number of businesses that have been utilizing the SOAR programming, having people come out. Then just, continuing to take those requests, we'll continue that work. That's not going to end. This is not the end game, certainly, as you can tell by what's happening across the country. But it is certainly something that we're feeling grateful right now for the place that we're in. It's kind of a place to sort of take a pause, sort of reinvigorate ourselves and get ready for what comes next for our community. And so we'll be ready for that when it does. A couple things when you go on our website to COVID-19, siouxfalls.org/COVID-19, there's the COVID dashboard, and so our GIS department helps put that out on our website, and we're really grateful for that. You can get those SOAR resources online on that particular webpage. There's individual and family guidance available on that page, as well as an update on city services opening and which particular buildings have which level of interaction that you can have, whether you have to make an appointment or whether you can go in and be served, et cetera, and what's expected of you and what you can expect when you go there. So with that, I'm maybe losing my voice a little bit here. So with that, I'd be happy to answer any questions that you may have.
Thank you for the presentation. Questions? Councillor Sale.
Thank you, Councillor Knight. Director Franken, first off, thank you very much for coming back with a little bit better news than we've seen in the past. We often get a weather report every day, and it talks about potential things that might come. And I really don't put my pickup in the garage unless I know it's going to hail. You're giving us the weather report. What can we look for? What do you look for that would indicate to us that there is something that is immediate danger to Sioux Falls? It's not long-term. It's not the charts you're giving us are great for the big picture, but what do you look for on a day-to-day basis that might spur us into action again on the COVID?
Sure. Well, in addition to looking at our dashboard every single day, we're really looking at what's happening around us as well. And that's why knowing what's happening, in western Minnesota, northwest Iowa, northeast Nebraska, West River, what's going on around us, because, like in some of our communities, they maybe don't have as many cases as we do, but when they're a really small community, their per capita numbers can get pretty high. And so, we are really paying attention to even the small communities like in South Dakota and around us, and where we're seeing increases there, because we're not in an island, and those folks that are in those small communities around us are coming into Sioux Falls to spend time, spend money, find things to do. And so, we want to make sure we're paying attention to that as well. But it would be really watching. We know so much more now than we did months ago. So we probably, would monitor those rates. But once we moved out of that low incidence plateau, and once we started seeing a 14-day trajectory moving up, and you start seeing how often you're doubling your days again and kind of going into that pattern where we talk a lot about that, that's when I would start being concerned again. And you would hear about it, yeah. Mm-hmm.
Others? Anybody on the phone?
Councilor Neitzer?
Yes, Councilor Brecky.
Just a comment. You had asked earlier, or you mentioned that you didn't know how often you'd be coming to see us. I just want you to know that I really appreciate the level of briefing that we've had on this all the way through, and the fact that you're dialing it down to once a month is just fine, or as necessary, or if something comes up before. But I do appreciate the ongoing, because we're living with it. It is part of our new normal, and I would just like to add my 2 cents that I hope you'll be coming back at least once a month, or as necessary, depending on circumstances warranting it.
I'm happy to do so.
Thank you. Any other comments from the phone? Not hearing any. I'm not seeing anything else. I just do have a question. I don't follow this day to day, but what do we know about any potential vaccine development, or has there been any breakthroughs in terms of therapeutics, whether it be pharmaceuticals or anything else?
Well, sure. So remdesivir is still proving, to have some effectiveness in helping with treatment. And then also Decadron, which is a steroid that's been widely used. I used it in pediatric ICU patients, for years back in my nursing days. And I'm still a nurse, by the way, so I still am. But when I was doing patient care in peds ICU. And so they're starting to see, some effectiveness there. I think they're also learning a lot about what to do earlier on if you have a patient that becomes really sick and ends up in the ICU. You've heard things like putting people in a prone position. You've heard things like maybe trying to avoid putting them on a ventilator as long as absolutely possible, things of that nature. So there's probably not like that magic treatment like maybe antivirals, which you see with influenza if given early enough. So they're still working on some of those types of things. But you're starting to see, some trending in how to care for patients that can help them maybe have better mortality and morbidity with it. As far as the vaccine, that's a gallop race right now, worldwide to try and get vaccine, to show the efficacy, the prevention effectiveness, and then also be able to get it manufactured in a quick fashion. And so they're doing things they've never done before to try and spur that along and get that happening as soon as possible. But I haven't heard anything yet definitive about when that would happen. I mean, it would be wonderful if, sometime early in 2021 we're, giving vaccinations for COVID, but that's still to be determined, so.
And are you reading any literature in terms of anything that they might be finding of common patterns of who might, there's been discussion about why some people may get it and why some people don't. So I've heard things such as blood type, and obviously this is early and science is always evolving, but.
Yeah, I wouldn't want to speculate too much on that yet, but certainly there's so many interesting things to read about that they're finding about this virus. Things they're still continuing to learn about this virus, things they're understanding about, how much more significant spread can be with certain individuals or in certain situations, and so yeah, nothing's definitive yet as far as, studies that can prove out, various, what they're learning, but certainly making some progress. So, but more to come on that. Maybe that can be next month. I'll know more.
Absolutely.
Okay.
Keep learning every day.
Yeah.
Okay.